My name is Raj Mookerjee, and I'm a professor of translational hepatology at University College London. I'm also a consultant hepatologist at the Royal Free Liver Transplantation and Specialist Unit in Hampstead, London. Hepatology was really a fascination for me right from the time I was a medical student. I was very privileged to have passionate teachers who, within their teaching, would show us the importance of really how a multi-system disease, as most liver patients have, really is a challenge, but it's also a pleasure to try and get more and more involved in trying to find better treatments, better diagnostic information for such patients. And I think really that bug bit me very early on. And then during my training, I again had the privilege of working in several units where there was a lot of specialization, particularly around the liver, and then went on to do some further research specifically around what causes liver disease to progress in advanced cirrhosis. And I think with all of these facets, it became almost a given that I would become a hepatologist because of the real excitement and enthusiasm I have for all the problems that we deal with, but also the great feeling it is to actually see solutions that start to change people's lives for the better. The most rewarding element is that the population with liver disease is often a young one, and these are people who are desperately trying to get back to work and just living a normal life. And I think to be able to make a difference, even if it's not to provide a curative solution, but at least to improve their quality of life so they can start to have some functionality back and ideally be back at work, I think that's a huge thing for any doctor, but particularly in a disease specialty where patients are often very young. I think most patients will find that I like to give them time. It's actually important, and I think to practice in a very holistic way. So beyond just focusing in on the immediate acute problem that needs addressing, one sometimes has to understand other issues that may have contributed to that problem. And I think, again, the complexity of liver disease patients as they are, there are often many other factors in their lives, including social elements, addiction to alcohol, other facets, which mean that one has to actually give them that time. And I think that that's something certainly my patients have fed back rather than just homing in on the problem. And I think valuing this population, again, as I've suggested already, they are a young population who are desperate to just carry on living their lives. And I think it's a privilege and a duty as a physician to try and make sure that we give them the best opportunities. And I think sometimes it is a matter of, again, really pushing the boat out a little bit to look for solutions which aren't readily apparent. And that's one of the things of being a clinician scientist. I like to look beyond the immediate frame so that we can actually look for solutions which may be appropriate but may not be already licensed therapies. Challenges are a bit like the benefit, because these are often very complex clinical situations. So the liver disease, when it starts to progress, often involves many organs. So one's not just focusing on the liver, but the effects on kidneys, the brain, the heart. And it's trying to juggle all of these organs and the factors that are causing each of them to go down. And that has been a challenge for people practicing hepatology for decades. I think our time is now, whereas perhaps in the field of cardiovascular medicine, there are a lot of advancement made even 20 years ago. I think in hepatology, it's really been within the last 5 to 10 years, but I'm excited to see that there are now lots more potential treatments because of our improved understanding. And I think that challenge, whilst it's still there, is a little less, and it means that we will have more to offer our patients.